If a patient has a good relationship with a primary care physician, then you could benefit. An employer and the employees and their family members can benefit by just having early detection of medical issues. And when the employer thinks about investing in building those healthy relationships, then at the same time point solutions that help them control costs for the claim that has just been filed and paid, it's a combination of both. And many times the employer has looked at point solutions on the latter end, but not necessarily what they can do to affect the healthcare delivery to their employees and their family members on the front end. So we're connecting the dots between those two programs, health insurance and healthcare.
Todd, Josh, thank you so much for hopping on the podcast today. Excited to speak to you too and learn about the work you're doing at PMR Healthcare. First, Todd, I'm going to start with you. You've spent over 40 years in this space, starting in insurance and now building employer-led care models. What's the story? And I'll mention you brought Josh on board as well, who has a background in this space, as a background as a broker. What's the story behind PMR Healthcare, and what pushed you to join PMR and take this approach that you guys do at PMR?
Bert, as you referenced, I started out on the health insurance side of the equation, both as an underwriter and health benefits claims manager, and then a broker producer in the employer market. And I was introduced to primary care clinic access solely dedicated to employers. And at the time when I was introduced to that was a benefit solution that I had never heard of at that time. So just in researching it more, it ended up being a benefit that when I presented it to the employer groups that I represented, that there was a real demand and need for it. So at that point, based upon that interest, I switched over to the healthcare administration side and I've been working in this space since.
Josh, do you want to share a little bit about your background and what led you to PMR?
Yeah, absolutely. So I've spent my entire career in the health insurance industry world, the last 21 years of it being on as a producer, broker. And I believe that, big corporations tend to remove the ability for you to help the little guy. And I think that's where I felt the most gratitude in my career was when I was able to help individuals, help the small employers navigate through the healthcare system and the access. And when that kind of was removed from my ability, that's when I decided to make a change. And when I saw what PMR Healthcare was doing for employers, it really benefited them. And I felt like this could be a lot more rewarding long-term for everyone.
Yeah, 100%. And I'd like to dive deeper on that, on the work you guys are doing for employers. I think, Todd, you shared a really interesting statistic with me that 34% of the country still doesn't have a primary care provider, if I cited that correctly. Why is that still the case, and how is PMR Healthcare giving people fast, affordable access to care, primary care, for example?
That 34% has been an average of what we see when we review the employer's data that we are provided. It seems to be holding true from coast to coast. It may vary 30, 35%, but for most, it's on the higher end of that scale. So multiple reasons that are contributing to that. There is a shortage of primary care physicians across the country, which is limiting. The typical, where folks don't think about the need for healthcare until they absolutely have a health issue. And then generally the emergency room or urgent care centers fill that gap or that void. So with PMR Healthcare, our goal is to literally bring a dedicated primary care physician to those individuals. If physician practices in their community are closed, not accepting new patients, this would be a physician dedicated to them that they could immediately see with maybe next day appointments, for example. So it's just filling that void. PMR Healthcare fills that gap for that high percentage that don't have a primary care physician.
Yeah, right on. That's a big problem. I mean, talk about the amount of Americans and people that are part of employer-sponsored plans that don't have primary care providers. And you guys have been able to fill that void gap like you're talking about. And Josh or Todd, feel free to weigh in on this one. But, I do feel like a lot of employers out there are overwhelmed by point solutions that brokers give them, whether it's different tools, and it may seem like none of them, are connected and there's so much thrown at them. What are you seeing in the market, and how do you help employers like get out of this trap of like typical broker employer relationships? And what are you guys seeing generally in the market?
Over the decades, let's say starting back in the 1980s and fast forward to today, the employers have experienced, incremental increases in the cost of providing benefits to their employees and their family members. So they look to those point solutions that you referenced, and we're all for that. I mean, there's several good solutions out there to help employers control those costs. What we're trying to do and what we're succeeding at doing with PMR Healthcare is connecting the dots between what the employer can do to reduce the cost of the benefits program itself and connecting that to the actual delivery of healthcare services. For example, if a patient has a good relationship with a primary care physician, then you could benefit, an employer and the employees and their family members can benefit by just having early detection of medical issues. If the patient has medical issues, better help that patient comply with whatever treatment regimen that they have, for example. And when the employer thinks about having, investing in building those healthy relationships, then at the same time, point solutions that help them control costs for the claim that has just been filed and paid. It's a combination of both. And many times the employer has looked at point solutions on the latter end, but not necessarily what they can do to affect the healthcare delivery to their employees and their family members on the front end. So we're connecting the dots between those two programs, health insurance and healthcare.
Interesting. Can you provide like the audience an example of that, like that connection of dots, like with a specific maybe like type of patient population or type of service like rendered? Is there an example that comes to mind?
Well, let's say if it's an employer that has contracted with PMR Healthcare to provide dedicated physician services to their employees and family members that are on their health plan. What would occur is that clinic, that physician clinic, is either going to be on site on that employer's premise, or it might be in a near site location that just makes ease of access for any of those health plan members. But when they want to schedule an appointment, whether it be for an immediate need or if it's for helping them manage their disease state, those appointments are usually same day, next day. That physician is only there to treat and work with the population that employer represents. They're not open to the public. It allows the physician to get to know the patients well, get to know their history, get to know their families, get to know what type of work they do, work with them on lifestyle behavioral issues, early detection wellness examinations, help them navigate the healthcare system if they need to be referred out for specialty care or if they had need for hospitalization. So all of those are so many different touch and opportunities for that physician and employee to maximize and improve health outcomes is the goal.
Yeah, right on. Yeah. And how do you like help an employer figure out what makes the most sense for them? Whether it's like, hey, we need an on-site clinic, or we need like something that's more virtual or has hybrid, a little bit of both, How do you guys go about figuring that out with them?
Every employer group that we work with, we start with just a review of their census data, which tells us the makeup of their workforce. So you're learning everything about the mean age, the male-female balance, the number of dependents that are on the plan, the type of industry that they're working in. All of that helps us present options to the employer that, based upon their census data and their actual insurance claims data, there are options presented to the employer, discuss which of those options appear to most impact the health outcomes and the cost to the employer. And then through just the proper due diligence, they make a decision about which model to proceed with.
Yeah, right on. I mean, that sounds like it's incredibly valuable to these employer groups, because you're basically able to pair the census data, like of their employer data, with like insurance claim data. And I'm sure that reveals a lot of their makeup,
And it's usually, Bert, multiple years worth of data, so you could see how they're trending from one year to the next, just to allow the employer to make the most objective decision that they can. You brought up a great point about remote or virtual care. Many times that is an option that's presented to the employer, is this is on-site or near-site access to a physician that you can visit in person, but then also the ability for employees and family members to call in to the provider and have a virtual appointment with the provider as well. But it would be the same provider physician each time for continuity of care each time that you call in. So many times it can be a hybrid. The physician may talk to you virtually, but then want to have you come into and see them in person, next week, next month. So it can be a good balance between the two.
Right. And I know you have a lot of impressive case studies on your website, but off the top of your head for the listeners, how many on-site clinics do you guys have across the country? And then what type of employers, if you can throw out types of employers that you guys have worked with?
The motto is the physician on-site model is presented to employers in all industries. They all have a need to help control the cost of healthcare, to reduce the amount of out-of-pocket that they're paying when they are receiving services. They all desire to live healthy lives. So it's really no one's immune, so to speak. I mean, it's a good model for any employee in any industry. The case studies, these generally resonate mostly with employers who are what we call self-funding their medical plans. Those are individual companies that are paying for the healthcare services that their employees and family members receive through their own assets. So they're not buying insurance from an insurance company. They're literally covering the cost through their own assets. So every dollar we can help them see that they can save, every improved health outcome that we can generate by the employees just allows for a more productive employee. So the employer starts to see multiple ways that they can benefit by offering this type of service to their employees. So if it's an employer that's self-funding their medical plan, very attractive in any industry.
Yeah, interesting. So there's different models that can be on-site, remote, hybrid, virtual, but also, it's self-fund, different types of insurance models as well with their employees, whether it's self-funded or not, which is not, I guess, your quote unquote a traditional insurance plan, but they're self-funded. Like you said, they're paying through an asset. What kind of results are you guys seeing when it comes to you mentioned out-of-pocket savings and outcomes for the employers? Or any stories come to mind of results? I would love to understand results and if any stories come to mind.
Earlier, we were talking about, or I made reference to, employers are always looking for ways to reduce their healthcare spend or their spend in order to provide healthcare coverage to their employees. And one of the ways they've done that over the years is they've been forced, for lack of a better description, to raise the deductibles that the employees and family members have to pay. Somewhat of a cost shifting mechanism in order to share that cost. Deductibles that employers have today may range from $1,000 deductible plans up to $5,000 plus annual deductible plans.
Right.
You might have a co-payment that you have to pay if you have an office visit that might be $15, $20, $25 per office visit. You may have a co-pay for any prescriptions that might be prescribed, and that co-pay might be $15, $20, $40 per script. There's variances. Some can be higher. But what access to an employer-based clinic like we're discussing here does is it removes the financial barrier that the patient has, because in most instances, that deductible or that co-payment that I referenced is waived when the patient comes to seek care from this employer-based clinic. So you're removing the financial barrier for why somebody might not be seeking healthcare. The employer benefits by the employee seeking healthcare at this most efficient level. And so it ends up improving the health outcomes, the performance of the employee on the job, so on and so forth. So it's endless as to the benefits for all the parties in the equation. But from a financial perspective, that's a big incentive for the patient to use the clinic. It's just the financial barriers that are removed.
Right. Yeah, well said. And if it's clear that if for an employer it can reduce their healthcare spend, right, and then having access to this employer-based clinic removes the financial barrier for patients, why aren't more employers adopting this approach or model? What's stopping more of them from adopting this on-site or hybrid virtual model? What are you seeing there?
For the employer, there's so many issues that they're dealing with just on their businesses in general. I mean, if you take just what it requires of them to manage their business on a day-to-day basis and the continual changes. For example, tariffs right now, or the discussion of tariffs, it's caused many employers to have to step back and reevaluate what that impact might be. So there's things that just on running their day-to-day business. So our message to the employers is that their annual spend to provide these insurance services to their employees is usually the second or third most expensive line item on their financials. So it definitely deserves attention. And that allows us to segue into a conversation about mainly education. Most employers are not aware that this model exists. There's a lot of time that's spent educating on the model. They have great questions about why would physicians like to practice in this type of setting? What other employers have participated in the model? What's their results been, for example? So they're asking the right questions, but the biggest issue is most are not aware that the option exists. There's a little bit at times, Bert, about that after all of the proper due diligence is done by the employer, for example, just that apathy in general, making that decision. Adopting a clinic, when an employer adopts a clinic, we try to do as much of what we call the heavy lifting for the employer as possible. That involves us educating the employees on how to access the care. It's having them meet and greet with the physician so they can begin to get a sense of who they might be scheduling an appointment with. There's HIPAA compliant information that is shared with the employer so that they can see the benefits of providing the service, both the financial benefits as well as the health outcome benefits. So it's continual education. It's working this into their priorities and then validating the results with just constant report and information. So it's a journey. It's a journey.
It's a journey for sure. And something you said stood out to me, that you said it's like the second or third most expensive line item. Like basically this employer sponsored insurance typically is what you're getting after. Wages, I imagine, It's
very common, very likely that it is the second or third most expensive line item after payroll. And if I'm an employer, I've had my own business and a staff of employees, and it may be an extreme example, but think about when you have gone to work with just even a head coat. How productive are you? Today, it's not uncommon for employees to have multiple medical issues. From an employer's perspective, it's also sharing with them what's the impact to their business, to their culture, to their relationships with their clients by just merely sending a message to their employees that we care about you. We're providing these direct services to improve health outcomes. They will most likely see that through whatever throughput measures that they have for their companies. Over time. They're providing an option for their employees to adjust and modify lifestyle and behaviors that lead and contribute to long living, healthy living, well-being, so on and so forth. So it really is endless, but it's a whole lot of education. I believe employers have been sold a lot of services that have not necessarily generated results. So it's created a little bit of natural resistance by the employers that this almost sounds too good to be true. So that's why we try to connect them with other employers, hear it directly, encourage as much objective review of their data as possible, and then hopefully they make the best informed decision they can.
Right. The value is there irrespective of the size of the employer too, right? Like you guys have been able to deliver these on-site like models for a smaller employer to an employer with like thousands of employees, right?
The service right now, it's primarily for, earlier I mentioned about employers that self-fund their medical plans. Those employers that self-fund their medical plans are usually employers that have larger employee counts. But that varies by state, Bert. There are some employers who are self-funding their medical plan that have as few as 25 employee lives in some states across the country. Back in the late 80s, early 90s, that was unheard of. It was usually employers much larger in terms of their employee count. But one of the beautiful things about the model is that now we're working with folks in various regions of the country to offer it to those smaller employers and also to employers that are even insuring their health programs, not self-funding, but even insuring their programs through an insurance carrier, whether it be a Blue Cross or a United Healthcare or someone. So it is evolving, but right now the the main employers that we direct our attention to are those who self-fund, which generally are going to be larger in employee count.
Interesting. And the data shows, like, just to get a like a rounder picture, like them going through PMR Healthcare to establish like a near site or on-site clinic for their employees will over time lower spend, as opposed to their employees like going to someone in their network through a separate plan, or the lack thereof, right? Is that the big picture?
It is. It comes multiple ways. So let's say if it's an employee or family member who does not have a primary care physician and they need medical care, they might seek it from an emergency room or an urgent care center, which is going to cost the employer a great deal more. If they do have a primary care physician, the patient, and they choose to use the physician at the on-site clinic, then the employer is basically billed for that office visit, any associated labs, or any medications that are dispensed at basically a wholesale cost level. So less than what that same visit, lab, or prescription service would have been billed to the health plan had it been received outside the clinic, for example. An employee that accesses the clinic and through an annual physical, there's an early detection of cancer or whatever medical issue there may be, then more than likely will not only potentially save the life of that patient, but also reduce the cost of care that patient may need over the period of time that condition exists, for example. So it's endless. We have folks that forego their medications today because they can't afford them, but through an on-site clinic, they don't pay anything for those medications in most instances. We have folks that split their pills because they want to stretch them out over time because they can't afford the copay for prescriptions. The clinic discontinues that practice because, once again, the patient generally isn't paying out of pocket for the prescription. So I give you a couple of just very simple examples, some that are a little bit greater in scope, but all of those collectively is what helps the employer better manage their health plan, better manage their risk.
Right. Otherwise known as like the iron triangle healthcare, like cost, quality, outcomes, like how do you reduce costs, improve quality and outcomes, and like having this near site or on-site clinic in a way feeds that, and like you gave some powerful examples of foregoing medications, or worse, not having a primary care provider. And then you're ramming up costs because you're seeking your local ER, right, or ED department. So,
Josh can probably relate to this very easily through his work as a benefits consultant for employer groups, that there's many employees that are not early detected for early stage cancers and things of that nature. And they present themselves and they might be stage 2 or stage 3 at that point. Wow. Well, those are not only high cost claims to the employer, but look at the impact potentially to that individual and their well-being. So it's just all of these issues get addressed. And those might seem like extreme examples, but very common examples. We opened a clinic in the Pacific Northwest, and in the first 30 days, there were multiple cancer diagnoses and multiple diabetic diagnoses. And these are individuals that did not know that they had these ailments, maybe didn't feel quite right, didn't think something was off. Well, if they didn't have access to this type of clinic services, they may have gone weeks or months before they sought the appropriate necessary care. So it's real issues. It's affecting real lives and real outcomes and real cost. And
no, it's fascinating. I'll let Josh chime in a second, but like not just like point of care diagnoses like cancer or diabetes. Like I just think where we are in the healthcare industry, where like diagnostic and tools and there's going to be better diagnostic tools like risk screening, like that employees can even do at their home, and if we bring that closer to the employer, where a lot of patients, employees still get their insurance from, it makes that like ability to receive care easier, and it brings down costs, right? So like I think as technology evolves basically in the industry, it's just going to open up more doors for you guys too, with these employers, and they're going to start to ask questions like, well, like my employees have asked for this type of coverage. Like, are you guys able to offer that? So I think it's pretty fascinating.
Yeah, I would say my time as a broker consultant, we spent a lot of time analyzing data. And data is only as good as what the employee and employer relationship can help manage it. If there's not engagement and correcting the population health, then the data is pointless. You're just telling the employer where the spend is going. So I think
Right.
that the best world that PMR Healthcare exists in is it removes the cost barrier to the employee, gives them immediate access to primary care services. Now the primary care doctor is able to actually address the root causes of the medical issues to help change their lifestyle, to change their conditions, to improve
Right.
their health outcomes long term. And then there's no reward for the insurance companies, if you will, to keep on having visits, repeat visits. The cost of care is a real issue, and PMR Healthcare really addresses it on all levels.
Yeah. That's a great just synopsis there, Josh. Yeah. Well said.
Bert, one thing that came to mind when Josh was making that comment, everything that we've been sharing about the benefits and the real life issues that are occurring are being exacerbated somewhat by just the mere shortage of primary care physicians around the country, across the country.
Mm-hmm.
And this has manifested itself. It's probably been coming on for quite some time, but post-COVID, there has been a number of providers who have exited the healthcare system. And we're in situations where even if you wanted to schedule an appointment with a primary care physician, you're talking about anywhere from 4 to 12 weeks to be able to see that primary care physician. It depends upon where you're at in the country. If you don't have a primary care physician today, and with the shortage, it's very difficult to find a primary care physician whose practice is open to new patients. So everything we've been talking about over the last several decades that's contributed to rising healthcare costs and the less healthier U.S. population is being exacerbated by just the mere shortage of providers. So it's a whole supply and demand issue. So employers have been trying to manage this with various point solutions for the several years, several decades. It's now at the point where we really have to address how to make these healthcare services more accessible, how to engage patients very early on in these primary care relationships and that. And it will take a while to turn the tide because it's taken us several years and decades to get to this point. So
Yeah. Yeah, right on. And are there any industries that you guys are excited to keep digging into, or where you're seeing a lot of these opportunities to make access to healthcare more accessible?
Well, once again, it is a model. Everyone, regardless of what industry we work in, for example, everyone's subject to the same healthcare challenges, access, expense. At the same time, there are certain industries that are more prone. If you have a workforce, for example, that is an hourly workforce predominantly, that maybe has hourly wages between $15 and $20 per hour, a $3,000-$4,000 annual deductible on your health plan and co-payments for visits and prescriptions is a big impact to that person. So this is really providing the necessary healthcare services to those populations at a much more affordable level. So that's probably, and that might include manufacturing industry, logistics centers, things of that nature. But even for individuals, that maybe they're salaried positions and higher pay levels, for example, it's still very much the same issue. It's early detection, building a relationship at the primary care level, help with navigating the healthcare system, which is very complex, for example. So there's a need on all places, but there are some industries where there's actually seems to be more opportunities than others. So.
Yeah.
I would say when you look at the population for employers, the spend that you're trying to control is the high cost claimants. Those are the biggest claim dollars that impact the bottom line from a budgetary standpoint. The goal is to take those highest risk individuals and improve their health to the next lower risk level, and so on and so forth. So as Todd mentioned, if you can engage them early on with prevention and wellness and continued visits when access is available, when the condition first persists, then you can start to control those catastrophic claims, which is the long-term impact that you can't really measure until the return on investment is shown over a number of years.
Right. Yeah.
A great example.
Yeah, that is a great example. Like, and I think a lot of people may not know this, but this whole risk pooling concept, that's how like insurers end up pricing their premiums, or like their plans is through risk pools. So you guys, in a way, are almost helping employers get a sense of their own risk pools and managing the cost, right, for their own population, right? So it's like kind of like bringing it down to their level of like, okay, like this is how insurers typically will do this at a macro level, like across employers and populations. We're going to help you do it for your employees.
You hit the nail on the head earlier when I mentioned that we review the census and the medical claims data for the employer. That's really allowing us to create a risk profile for that specific employer and then present some custom options to them to, once again, to reverse whatever medical issues are occurring, cost issues that are occurring. So it's actually establishing a risk profile for each employer.
Yeah, fascinating. I'm sure that's super helpful for them to understand that. I would venture to say a majority of employers out there don't know their risk profile until something catastrophic happens, and then they're asking the questions, right?
But there really is, for any employer that has the opportunity to just review or see this podcast, if you think about they are challenged with rising healthcare costs. They're continually looking for ways to provide affordable coverage to their employees. They have to be competitive with what other employers are providing. They desire to build a healthy culture. They have all of these good, right objectives. When you think of an employer-based clinic, when you're providing access to your employees that's dedicated physician access to those employees, when you're removing the financial barriers for those employees, when you're reducing the cost for every unit of service in almost all instances of care that's being rendered through that clinic, you're early detecting potentially catastrophic medical issues, you're helping to reduce the likelihood of other catastrophic claims, you're helping patients navigate the healthcare system, which can be overwhelming to folks when you walk into specialist offices or hospitalizations. And we haven't talked about it, but we duplicate many of these services on the workers' compensation side. So when the employer has a worksite injury, this is immediate access. This is helping the employer, address the immediate healthcare need of the patient, help them get back to work timely, help the patient, be functional at work and at home. I mean, it's endless examples. So when I look at employers, it says, in light of everything going on within the healthcare industry, this is the most comprehensive solution for that employer to consider and hopefully adopt than of all of the various individual point solutions that are out there.
Yeah, spot on. I mean, no employer wants to go through the headache of a workers' comp claim, and it puts a strain on the system, because then who pays for that on the provider side?
The beautiful thing about the model now is that we're helping. Earlier, we talked about educating the employer to help them make the most informed decision for their population. But there's an opportunity to really bring the specialists that are in various communities into the equation, opportunity to bring the hospital into the equation to better understand what the objectives of the employer are. And those conversations don't happen direct today in most instances. And so this model is actually driving those direct conversations. And the employers pay 65% of all the healthcare dollars. They're between the employers and the government, they're paying for all of these healthcare services. And so the employer, bringing the employer community and the provider community together to have direct conversations, is engaging the whole community. Our goal here is to make sure that hospitals beneficiaries of these services as well, for example, and that's a whole separate conversation. But the main point of my comment is that this is bringing actually specialists and hospitals into the equation as well, and how can they be part of the solution for the employer? And the clinic is driving those conversations.
Yeah, spot on. And with that said, I want to ask you, like, for any employers out there listening, or potential like provider partner, like hospital partners or other leaders who are curious about this like on-site clinic model or near site or virtual hybrid, what's the best way to connect with you and your team online at PMR Healthcare?
I mean, the most standard response is truly our website at pmrhealthcare.com, but also on LinkedIn. If you just enter in PMR Healthcare, you can follow us there where there's constant, almost daily, weekly updates that are provided there as well. So those are the two simplest ways from a podcast perspective. I could throw out the phone numbers and things of that nature, but those are really the two best ways to connect with us. So pmrhealthcare.com from a website, or PMR Healthcare via LinkedIn, and you can follow us there for continual updates on the industry and the proposition itself.
And if an employer is curious, could they get like a risk profile done, on their business? Is that something you guys offer?
Thank you for asking that, because I would have been remiss. If an employer has interest, then they will be able to find through both of accessing either one of those sources how to reach us. And it's what drives us every day when we wake up, is to be able to have conversations with employers, review their data, and then be able to provide them that feedback and that profile. So that's really what drives us each day, is the opportunity to tell this story and bring it down specifically to what it means to them.
Right. Having an informed conversation based on some data, I'm sure helps move the conversation along. Yeah.
Josh and I wake each day for the opportunity to have those kind of conversations.
Yeah. I imagine you two have spoken to hundreds of employers together, and have touched many, many lives and many employees. So appreciate the work you guys are doing out there. And it's been a pleasure having both of you on the podcast today. And we'll definitely be keeping tabs on your guys' journey at PMR Healthcare as you keep working with employers of all sizes across different industries in a space that I think needs a lot more attention. And I'm sure we're just at the tip of the iceberg in terms of adopting these on-site and near-site clinic models, which I think will become more of the norm in the future, So appreciate the work you two are doing. And thanks again for hopping on the podcast today.
Thank you, Bert, for the opportunity. Josh,